80% of hair transplants will fail if you don't follow this 20% rule. Do you hear what I said? 80%, that's a pretty high number, right? So you have to listen. If you're planning for a hair transplant, trying to make the decision for a hair transplant, you need to make sure you stay in this 20% that your hair transplant is going to be successful. Now, if you're coming across this video for the first time, my name is Dr. Echefu. I'm a hair transplant surgeon. I've helped thousands of people regain confidence through hair regrowth and hair transplant. So now, what am I talking about today? So 20% rule is that what you have to do to ensure the success of your hair transplant. I don't care where you're going to get a hair transplant, but you have to make sure you follow this 20%. I've seen a lot of my clients coming in for hair evaluation, wanting a hair transplant, but they are not compliant with taking their medication. They are not compliant with following instructions on what to do concerning hair loss. And sometimes people actually think a hair transplant is like, is a simple procedure. Let me tell you, it takes anywhere from 8 to 12 hours, sometimes 16 hours for a hair transplant, for a successful hair transplant. So I want you to understand that it's draining. So when you're trying to make a decision in going for a hair transplant, you have to factor in these 4 things that I'm about to tell you. So for you to stay in that 20% of people making sure that their hair transplant is going to work, you need to follow these instructions. So number 1, do you realize most times, in fact, all the time, medical treatment is indicated for hair loss. So before making a decision to go for a hair transplant, you have to make sure your medical treatment, then you have to be compliant with taking those medications. So it's not enough being prescribed medication for hair loss. You have to be compliant. You have to take those medications because without the medical treatment, your hair loss is going to be progressive. So you're actually going for a hair transplant, but remember, you still have your native hair, which is going to get progressively worse if you don't take your medication. So that is why medical treatment is important. So you have to understand, in coming for a hair evaluation, medical treatment is important. So not just taking your medications before the hair transplant, it's also important to continue your medication after the hair transplant. Before, during, and after the hair transplant, it's very important for you to continue your medical therapy. You don't just stop. You cannot stop your medical treatment, because when you stop your medical treatment, you're actually missing one part of the treatment for hair loss. Remember, hair loss treatment can be medical, can be surgical. So if you're missing the part of medical treatment and just go for surgical treatment, you're actually doing yourself a disservice. So number 2, for you to make sure you stay in that 20%, making sure you have a successful hair transplant, you have to make sure you spend some time reading your pre-operative instructions and your post-operative instructions. Why do I say that? Now, in those pre-operative instructions, they're going to tell you what not to take, what medication not to take, when not to take it, what type of medication you should take. You should ensure you be on this medication. They're going to tell you what time you can have a haircut. They're going to tell you what time you need to have your hair washed. You need to read those instructions. Now, they're also going to tell you if you're on any multivitamins or any blood thinners. They're going to tell you if you need to stop it or not. So that is why those instructions are important for you to read, because it's going to guide you. Actually, sometimes when your doctor, you can't get a hold of your doctor, you head straight to those instructions, your pre-op instructions, and most especially your post-op instructions. I actually tell my clients to read the post-op instructions even before the hair transplant. Why? So that if they have any questions, we need to go over it. We need to talk about it. I tell them, whatever you need me for is in the post-operative instructions. If you need me, go to those post-operative instructions, because I thought about every single thing, right from the shampoo, the type of shampoo you need, the type of conditioner you use, and when to use the shampoo and when to use the conditioner, and when to restart your medication. These are things I carefully put in the post-operative instructions. So number 3, for you to ensure you stay in the 20% of people that are going to have a successful hair transplant, do you know the stages of hair transplant after you have hair transplant? Do you know the process, what's going to happen? You see, that's why I said make sure you read your post-operative instruction. Did you talk about shock loss? Shock loss, which is a period of hair shedding after a hair transplant. So it's very important for you to prepare, knowing that possibly you might have shock loss after hair transplant, and for you not to panic once you notice you're having hair shedding. So that is very important for you to know. So number 4, have you thought about how you're going to integrate back into your normal routine? If you're a busy professional, how are you going to put on wigs, or what not to do, or how do you cover your hair, especially if you have a shaven hair transplant? Have you thought about all that? So these are the things you need to factor. I cannot even tell you how many clients I have that come in and we talk about hair transplant and they forget about how they are going to integrate back into their normal routine, going back to the office and all that. So I have to make sure that I sit my clients down and teach them what to do and teach them how to cover their hair. If you've seen my videos on wigs and what kind of wigs you need or headbands, how to cover your hair, this is the time for you to go watch those videos. So it's very important for you to know how to integrate back into your normal routine. And these are the conversations you need to have with your hair transplant physician or hair transplant surgeon. And if you know someone dealing with hair loss and you don't know what to do, you've come to a stage where you're frustrated about your hair loss, you've tried everything. Now this is the time for you to make the appointment. You can actually zoom your phone right here. The QR code is right here. And guess what? The beautiful thing, we offer free virtual consultation. And someone from my team will talk to you and make a treatment plan for you. So let us know. Until next time, bye-bye.